Human immunodeficiency virus, also known as HIV, by Perlita Cabrera and Avis Ballester Perez. Case scenario: Rebecca is a 37-year-old lawyer in Los Angeles. She has been practicing law for 7 years. She works with many cases involving children, which at times becomes too overwhelming. To de-stress, she enjoys a glass of whiskey and frequents her local bar to socialize. She has not had a dental checkup or hygiene appointments for over 2 years and is now concerned about the yellowing of her teeth and mouth ulcers. She recently experienced swollen lymph nodes, muscle and joint pain, nausea, mouth ulcers, and headaches. Medical assessment and extraoral and intraoral exams. Upon the medical assessment, a COVID screening was conducted and no symptoms were present. Vitals were also taken and were within normal limits. Extraoral and intraoral examinations. Extraoral findings were swollen lymph nodes on the neck region, midsection of the right sternocleidomastoid muscle. Intraoral findings were a lesion on the lower labial mucosa. Per patient, I have been seeing these a lot lately. So, what is HIV? It is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS, which stands for Acquired Immunodeficiency Syndrome. There is no cure for this, but there is treatment available to slow disease's progress and prevent complications.
Clinical signs and symptoms. Symptoms occur within 1 to 2 weeks after infection, such as fever, weakness, nausea, vomiting, weight loss, skin rashes, lymphadenopathy. Symptoms clear in about 1 to 2 weeks. Oral signs and symptoms can be related to oral candidiasis, necrotitis ulcerative gingivitis, angular cheilitis, necrotitis ulcerative periodontitis, herpes simplex virus infection, oral hairy leukoplakia, and bluish-purple and red lesions due to Kaposi sarcoma. What if it goes untreated? Without treatment, symptoms last 1 to 3 years, like PGL, persistent generalized lymphadenopathy, fungal infections, vaginal gas and trichomoniasis, oral hairy leukoplakia, herpes zoster, herpes simplex, HIV, retinopathy. Common treatment modalities involve use of combination of antiretroviral drugs such as antiretroviral therapy ART and highly active antiretroviral therapy HART. Management special precautions, dental services, and medical consultations in the office. All patients with HIV should be treated with standard precautions and no different than other patients without the virus. Dental providers should continuously monitor dental and oral health for disease progression. If any other manifestation of HIV is present, the first priority is to relieve pain and treat infections. All procedures must be performed in a manner to minimize bleeding and avoid transferring oral pathogen into the deeper facial planes and oral spaces. A consultation and clearance from the patient physician should be obtained. Medical assessment of HIV-infected patients relative to their safe dental treatment is primarily based upon current laboratory test values, but always conduct intraoral, extraoral examination, check for signs and symptoms. Lab test values. The following lab test values are necessary to better understand the patient's overall health to be able to treat them safely. CD4. If count is more than 350 per microliter, patient can receive treatment. Viral load to determine susceptibility of opportunistic infections and complete blood count, CBC.
Suggested frequency of obtaining lab reports. Any CD4 count for all HIV patients. Inform the patient that you would like to be sent a copy of their laboratory reports anytime a test is done in order to keep their dental records current. CD4 above 200, you should obtain lab reports minimally every 6 months or as performed by a primary care physician. CD4 less than 200, obtain a lab report minimally every 3 months or as performed by a primary care physician. First question. Based on the information given to you upon Rebecca's first appointment, do you think the patient is at the first stage, which is acute HIV infection, or second stage, chronic HIV infection of HIV? Based on your answer, what should your first appointment consist of? Question number 2. In a future appointment, Rebecca has informed you that she has been diagnosed with HIV. How should you proceed with this appointment in order to give her proper care and allow her to feel comfortable under your care?